I've often said that the county council responds to the people who we see and hear. And it has been very difficult. As chairman of the HHS committee, I have tried to get input from affected workers on this bill, and it has not been an easy process to have folks who are struggling to get by at very low wages to come and speak to the county council or to the Health and Human Services Committee. I am informed that the study that we will, I hope, soon receive only contains input from employers. It does not contain any input from the workforce. And overwhelmingly, the folks who contacted me on the last iteration of this discussion were employers, not workers. And so I think it's easy to exaggerate negative impacts that this bill could have based on the people from whom we hear without adequately factoring in the positive impacts that increasing the minimum wage could have on families in Montgomery County who face a daily struggle to put food on the table and stay housed and pay for health care and transportation and all the other needs. So I, as chairman of the Committee of Jurisdiction, will continue to do my best to factor into this conversation the input of workers. It's not surprising that folks with more resources feel more agency and engage with us more fluently. But that's unfortunate because it really limits the feedback that we get, and it makes for a non-representative view, I think, of what people think and feel in Montgomery County. Now, in my conversations with employers, and I know all my colleagues had many, in the last iteration of this debate, I consistently asked, well, if $15 by 2020 is difficult to absorb, what schedule would be acceptable? Did you think that the minimum wage in Montgomery County would just stop at $11.50 on July 1st, 2017 and never increase again? And the folks I talked to invariably said, no, we didn't think that. And I responded, okay, so let's have a dialogue. What would be a schedule that would make sense? And in every case, the answer was, that's not what I'm here to talk about. I'm here to say, this is a bad idea, don't do this. So, Mr. Elrich and I have had this conversation. I believe he feels the same way. We would like to engage in a practical and realistic conversation about this, but it's difficult to do that if the employer community, which is primarily who we're hearing from, is not similarly willing to engage in some sort of honest give and take as to what schedule could be absorbed without harm to the economy. I've received information about a study regarding restaurateurs in Seattle that suggests that the minimum wage had adverse effects on restaurant employment in Seattle. And I've received information about a study regarding restaurant employment in Seattle that suggests that the minimum wage had not had an adverse effect on employment. So the study that we're about to get, I don't know what it will say. We haven't seen it. I've always, with some experience on this and discussing this with academics and with economists, there's a wide range of views on this. And if we wanted to commission a study that said that a minimum wage is good for workers, generally healthy for the economy, puts more money in the hands of retailers, and the purchase of goods and services, I think we could get a study like that. And if we wanted a study that said it's going to have very adverse effects on employers and lead to less hiring, I think we could get a study like that. What little we know, based on the evidence in Montgomery County, is that minimum wage increases did occur for 3 years running, and in each of those years, the unemployment rate in Montgomery County went down. It did not go up. That is not a dispositive answer to the question either. It does not affirmatively tell us what will happen in the future as a result of future minimum wage increases. But it certainly does not suggest that unemployment goes up as a result of minimum wage increases, because that is not what occurred. And then you face the question of whether paying a decent wage is the right thing to do, even if there is some small, limited amount in hiring reduction. Even if employers may potentially offer fewer very low-wage jobs, that in and of itself does not tell you that it's the wrong thing to do. To expect individuals to work at a wage that you just can't possibly live on creates an unsustainable conflict. And I absolutely agree with Mr. Elrich that it leads to the drawing down of public benefits at the public expense when private employers really should be shouldering that expense. It is not reasonable for people who work full-time to have to rely upon SNAP or TANF or even Medicaid. It is desirable that individuals find adequate income working hard in the private sector. Even $15 an hour will not close that gap, but there's no doubt that having employees work at wages that entitle them to public benefits is not in the public interest. So I thank Mr. Elrich for introducing this new bill. We will indeed have a robust discussion in the Health and Human Services Committee. I'm putting out a call to low-wage workers, if they're listening, or to service providers who assist low-wage workers. I really, really want to get the input of affected parties here. That has not been an easy thing to do. Employers are very eager to weigh in. Those who labor in the shadow of poverty, unfortunately, have not been ringing our bell or emailing us to the same extent.